My name is Garth Reynolds, the Executive Director of the Illinois Pharmacists Association, and welcome to Role of Illinois Pharmacists in a Public Health Emergency. Over this short program, we'll review the role of the pharmacist in public health emergencies and discuss the components of the State Memorandum of Understanding for pharmacies, local health departments, and the state. Let's first discuss the role of the pharmacist. So why utilize pharmacists? Well, we're the most accessible healthcare provider in our communities. We're ideally located in our communities and set up to provide care. We encourage our patients and our pharmacy team to prepare themselves for an emergency, and pharmacists have proven themselves capable to assist the public in an emergency, just like we did with H1N1 in 2009. Let's take a look at why we're utilizing a Memorandum of Understanding. It does have three major sections. First is the purpose, which describes briefly what the memorandum covers and how it will be utilized, the roles and responsibilities for the local health departments, and the roles and responsibility for the pharmacies. The purpose of the memorandum itself is to expand the capacity of distribution in a rapid fashion of medical countermeasures throughout the state of Illinois in response to a public health threat. Make sure that there's proper planning in place, proper training and ongoing training, and coordinated execution of medical countermeasures in the distribution to the public. And also to ensure that the pharmacy infrastructure is able and ready to assist in the rapid distribution and/or the administration of medical countermeasures to the affected populations during a public health incident, emergency, or disaster. Not only is this will be coordinated and into a standardized method statewide, but this memorandum specifically helps with coordinating locally the local health departments and the pharmacies in their communities, so that when these public health emergencies occur, we will be dealing with the local healthcare providers in the affected area. So let's review some of the highlights of the local health department's roles and responsibilities. Of course, they'll be coordinating with the state Illinois Department of Public Health and with also bridging that communication with the signatory pharmacies to ensure statewide consistency, not only with the screening forms, tracking, training, education, and other pharmacy requirements. Assist in providing the planning and technical assistance to the pharmacies, including but not limited to what supply lists will be needed, fact sheets, dispensing algorithms, and other applicable requirements. Provide medical screening forms to pharmacies as guidance for implementing dispensing operations. Activate community-wide mass vaccination dispensing plans as pre-approved by the department within the geographic jurisdictions. And notify pharmacies that IDPH pre-approved community dispensing plans should be implemented and when. And assist with the pharmacies with medical protocols regarding the pharmacy's response, including but not limited to dosing and follow-up procedures, medical countermeasures. And provide pharmacies with a reasonable and releasable information regarding the public health emergency situation. So let's review some of the highlights of the responsibilities and roles of pharmacies. Pharmacies will be participating in all training and exercise requirements of the department when offered. Coordinate with not only the state department and their signatory local health departments to ensure statewide consistency with the screening forms, tracking, training, education, and other pharmacy requirements. So there is a bridging of responsibilities in the memorandum. Comply with all lawful pharmacy standards in effect during the incident. Identify approximate realistic numbers of medication doses that could be administered by your pharmacy in a specific time period, and communicate that information back to the local health department. Receive store, and track medication deliveries consistent with all federal, state, and local government requirements at the pharmacies identified facilities during the incidents, and ensure that pharmacy sites locations are serve the general public, and at pharmacies' discretion ensure that their own employees, including those employed by its parent company and their families, are cared for. Again, this is a brief review of the Memorandum of Understanding. The full Memorandum of Understanding in its draft form is available at the IPHA.org website. The Illinois Department of Public Health lawyers are finalizing the version of the memorandum, which we will be sending out for signatures in late April, early May, and working with both independent, regional, and national pharmacies to sign on to this important endeavor so pharmacists can have a major impact in assisting their communities in a public health emergency. We'll be expanding our pharmacy trainings in 2017. We did have 2 introductory webinars which reviewed these slides and showed a brief review of some of the public health medical countermeasures training program in February and in March. But we will be having a full longer session at the 2017 Integrated Public Health and Healthcare System Preparedness Summit in June in Bloomington. We'll also be having a series of webinars that will be available because we know regardless of when we offer training programs, they cannot fit everyone's schedule, and we want to make sure we maximize the number of people in becoming involved in this important public health endeavor. And finally, September 7th through the 10th in St. Louis, we'll be offering an abbreviated version of the training at the Illinois and Missouri Pharmacists Annual Conference. So please watch out for updates at the Illinois Pharmacists Association website at IPHA.org. Thank you very much for viewing this short video and presentation reviewing the role of the pharmacist in a public health emergency and the importance of the new Memorandum of Understanding project. Please feel free to reach out to me via email or phone. And if you aren't already, please like us on Facebook, follow us on Twitter and Instagram and on YouTube. And again, thank you very much for taking this moment to review and prepare your pharmacy to helping Illinois expand public health.